In the case of a hiatal hernia, there are no real alternatives to surgery. Hernias often remain stable, and symptoms may be sometimes managed with medication and other therapies, but they never cure themselves. And putting off surgery increases the risk of developing a strangulated hernia and even breathing problems. Because of these risks, it's rare these days for a physician to recommend any treatment other than the surgical repair of a hiatal hernia. Surgical procedures performed by making an incision large enough to expose the entire operative area are called open procedures. Your doctor believes that your medical condition and overall state of health make you a good candidate for a less intrusive laparoscopic surgery. A laparoscope is a narrow tube that contains a light source and a small video camera. Using a laparoscope, the surgeon is able to operate by making one or more very small incisions, through which the sterile laparoscope and possibly other instruments are inserted into the body. Using the laparoscope's video camera, the surgeon is able to explore and inspect the interior of the abdomen, often allowing the surgeon to see with greater detail and with more clarity than with the human eye alone. However, it is important to understand that during the procedure, your surgical team is always prepared to convert a laparoscopic procedure to an open procedure, should they feel that your condition requires a more direct approach. If the surgical team makes this decision, you will find upon waking up that your doctor has made a larger incision and that healing may proceed more slowly. Converting to an open procedure will affect the length of your recovery and will probably require hospitalization. Of course, no surgery is completely risk-free, but your physician believes that if you decide not to undergo the recommended procedure, you may be putting your health at risk.